Well, so this is an interesting reflection. And there's a way in which sometimes I'm concerned about seeming cavalier or light, because it's not a light time. And there's also a belief I have that there's always lightness in things. So even in periods of strong emotions, sadness, if I think about my father's passing, I also have a warmth inside and a sense of tenderness and love for everything he gave to me, and how crazy it is that I can't talk to him now about what's going on in the world, and it's only almost 18 years. So it's with that I want to talk about a concept which is sometimes seen as an insensitivity or a really missing the point in holistic care, or in the New Age community, right? The words that sometimes differentiate something as insubstantial, with the language of the gift. This is something that happens in practice, and it happens with people who have had devastating occurrences in their life. It could be the cancer diagnosis. It can be a debilitating stroke. It could be the things that lead you to appreciate people lose things that are defining them or that seem essential. And yet there's something about those experiences that they call, in their own words, not labeled outside of them, the gift of it. Cancer taught me what mattered. My stroke brought me into a quality of gratitude about what was dear in my life that was otherwise overlooked. And it is this kind of upside down talk, right? Things can be the opposite of what they are. Somebody says, to be perfectly honest, you know they're not being perfectly honest. The gift is a really interesting concept, because if you don't receive it as the gift, then it is what it is. It's something that you either crave or something that you deny. And so coronavirus, which I am holding to some extent, in addition to the disruptions and the deep suffering that's happening, is also the quality of an awakening to these multiple complex and nuanced aspects of our lives, that if we choose to, if we slow down, if we hold things with awareness, don't overthink them or be driven by our emotions, then we've actually gotten something of use to us. So this language in the integrative medicine community or the holistic care community of the gift of things is to not preclude value in our human experiences. And the value is something that we forge, that we create and craft, just like all the adaptations that lead us into a bigger view of ourself, a bigger view of each other, or a bigger view of whatever holds us back by a small view. So there's the gift, and in medical fields, we have a language that is disparaging, and we call it secondary gain. And it's the idea that you use something not out of your goodness or your high qualities, but you use something to manipulate. I have patients who come in, and before coronavirus, they'd have a cold. And they come in for a visit, and I'd ask them how they are using their experience. Can they own the remote control? Can their husband make lunch for the kids in the morning? Can they see it as a chance to be tender and gentle with each other and unpack their schedule? So I'd like to suggest that of the work we need to do as individuals, as we have to do as a healthcare system, as we have to do as a political economy and nation state, as we have to do as a planet, that we think about the coronavirus as a reset from the business as usual mindset. And we use this moment in which we brace for what this could be to also reimagine life being set free from the barriers that we've accepted up until this time.